We are seeing incredible pressure on our healthcare system overall, not just hospitals.
Let's welcome in the new president of the Onondaga County Medical Society, Dr. Robert Dracker. Dr. Dracker, good to see you. Thanks so much for joining us.
Thank you.
You sent a letter as the new president of the Medical Society to your fellow members and colleagues about not compounding the stress on the system, especially on the ERs and the urgent cares. What have you been seeing, and what's the alternative? What would you like to see them do differently?
You know, the pressure we're dealing with isn't just on the hospitals, it's on the practices as well, and the urgent care centers, and the inpatient bed shortage that we have. And the problem is, if the children and adults can't be seen in the primary care physician's practice, they go to the ER primarily because they're concerned that they may have COVID and might develop complications of COVID. And so in the community, the primary care doctors have to do everything they can to mitigate the overcrowding in the emergency room so that patients who really need emergent care can get it when they go into the hospital. You know, today alone, I double and triple booked myself for patients who waited 7 hours or more. I'm talking about children in the ER last evening to get seen, and they never were seen. They finally just left. And so we all have to do our best. And the problem is, even if we have a certain number of sick slots and we try to maximize them for our patients, they fill up by 9:30, 10 o'clock every morning. And so patients get frustrated. They don't know what else to do. And if the children start running high fevers and they don't know whether they're COVID positive or not, they go to the emergency room. And that makes the situation worse. So the purpose of the letter was just to remind the primary care physicians in the area to do everything they can to try to maximize the patients they can see so that it doesn't overburden a system that is intended truly for emergencies.
Right, and we know children are your specialty. Are children making up more and more of the caseload? What are you seeing, and how sick are the kids getting?
The children have not been that sick. We have seen increased numbers in children every single day. We're either seeing children and diagnosing them with COVID, or we're getting calls from the families about what to do because their child just recently got diagnosed with COVID. So we're clearly seeing more cases in children. The children have not been that ill. Lately, we have not admitted a child for many months with COVID, and they typically get the typical COVID-like symptoms. However, children sometimes have a different presentation with COVID. They can have vomiting, diarrhea, and persistent coughs, and these are things that even the schools are having difficulty dealing with because they have children coming in with symptoms and they need to decide or determine if it's COVID or not. So they go back to their physicians or to an urgent care center to get tested so they can return to school. The problem is we have to make sure they don't have other illnesses such as strep pharyngitis or influenza or RSV. And all of these things are going to increase throughout the winter time.
Dr. Dracker, we hear so much about vaccination, along with masking and other, multi-layered approaches. But what are you saying to parents who, for one reason or another, are just not jumping at the chance to get their kids vaccinated? I'm talking 5, maybe all the way up to 17, 18 years old.
I don't really understand it. I mean, we've been having the vaccine clinics for the 5 to 11-year-olds, and we've done very well with it. I don't think we've had one parent call back and say the child had significant severe side effects. Some of the kids do have mild headaches. I think 1 or 2 have had low-grade fevers. One child, passed out at the time of the shot only because of the experience of having a vaccine, which children always do on occasion. But the children seem to tolerate it extremely well. And the data we have so far is that for the children under 18, right now, 2 vaccines seem to be adequate in resulting in a very good antibody response to prevent them from getting COVID. So, my grandchildren received it. My friends' children have all received it. And we've had no hesitancy in our office. There are some families that are against the vaccine, period. And, we have a similar problem with the HPV vaccine in adolescents. So some people, regardless of the literature and the scientific data we present, they're dead set against some of the newer vaccines, which includes COVID, unfortunately. But the vaccine is extremely effective. And as you know, there are still hospitalizations occurring, people who've had 2, but I've not heard of very many hospitalizations at all for adult individuals who've had the 3rd booster dose, which obviously has made a big, big difference in people. So, you know, constantly, day in, day out, I tell adults to make sure you get your booster dose as soon as you can. For the adolescents, I tell them to please get vaccinated. And for the children, getting more and more children vaccinated is only going to decrease the infectivity pool and the risks to people who, if they get COVID, can get very ill.
Important message to share. You know, the holidays are coming up, so exciting for the kids. They want to line up to see Santa Claus. They want to go to those holiday parties. What's your advice to families about navigating this holiday season in light of what we're dealing with again?
Well, I think if you have relatives that are going to come over and have not been vaccinated, they need to wear a mask in the home environment. I think it's only fair to do that. Some people don't do it, but it puts other people at risk. Vaccines for COVID, like we do for other illnesses, are variably effective in individuals. So even some people who receive the full vaccine series and the booster shot, individuals may not mount the same immune response than others do. And right now, anybody is at risk for developing COVID, regardless of the vaccination status or not. However, the severity is different. So we have to practice safe social exposures with each other and utilize basic things like masks when you're with people you don't know or you're in close environments, and good hand washing. And if you're not feeling well, you probably shouldn't go visit your relatives at the holiday time.
Dr. Robert Dracker, pediatrician, also now the new president of the Onondaga County Medical Society. Dr. Dracker, thanks so much for spending a few minutes with us tonight. Really appreciate it.
Anytime. Thank you.